welcome to an American Society of Nephrology podcast. This is Ron Falk interviewing Professor Roslyn Mannon, who is a professor of medicine and surgery at the University of Alabama. Dr. Mannon, how are you today?
I'm doing well. Dr. Falk, how are you?
Wonderful. It's cold in North Carolina, at least. We're about to have the opportunity to develop and to listen to Renal WeekEnds, and you have served as a faculty member for Renal WeekEnds for some time. What do you think are the special features of Renal WeekEnds, and why should somebody want to go?
Well, I think from my perspective as a faculty member, I've enjoyed, presenting at Renal WeekEnds for a couple of reasons. One, it really gives me an opportunity to review, in my case, transplantation, and to look at all the presentations performed and given at ASN, both poster as well as lecture and abstract presentations. And it really allows us to sort of look over the body of information and come up with a small curriculum in about an hour and 5 minutes. We try to present the best of the best to the audience. And I enjoy doing it not only because I learn from doing it, but I also enjoy the variety of people that attend as audience members. And we have folks that are very experienced in nephrology, some that are less experienced in nephrology, and some that are using this as an opportunity to update skills. And sometimes we've had attendees that have been at the general meeting but just could not attend every single learning experience, and so they come back to sort of update or review skills that they overlooked when they were at the meeting. As far as the faculty itself, we do develop close relationships, and we tend to sit through each other's lectures just to hear what the experts in the field think is important. From an audience perspective, this is a unique opportunity to take I guess it's now a 4-day meeting, or maybe it's a week meeting, and really, filter it down into about a day and a half. And the presentations are reviewed scrupulously by a small group of experts in each subsection, and then they're over-reviewed by the course director, who reviews the material to, assure himself that we really are doing an excellent job.
Dr. Mannon, how do you actually figure out what you're going to present?
Our strategy this year was we had a team of 3 of us, and we reviewed the program prior to attending the meeting, and then we each voluntarily attended as many or almost all of the transplant sections available. And during the course of that, you take, diligent notes, and you then have an opportunity to review the slides as an access. But we've also met informally by phone and by email to try to come up with the major topics that we want to cover to update the audience. And so sometimes you hear something and it sounds exciting in an abstract, and then you actually look at the abstract and say, maybe that's not the point I want to bring across. And we don't want to get too much into too much minutia in transplantation. We really want to, impress key broad concepts and the novel areas that transplantation is going to. And we also want to try to translate the basic science. We do attend all the basic science sessions, and for clinicians, I think it's important to keep abreast of the science aspect. And so each of us has very varied experiences, and so we try to cover the whole meeting and provide you all with an opportunity to hear what was probably the most significant of the basic science and how and provide our own spin on it and how it might relate to clinical practice, so it isn't just a bunch of details about receptors and cytokines and genomics.
In an hour and 15 minutes, no less.
In an hour and 15 minutes, no less.
And this same process then occurs for the other topics, including
pretty much.
kidney
I think,
injury and hypertension and the like.
And I think for the other sections it may be a bit harder, because for clinical nephrology and CKD, there's a huge amount of material. For us, the 3 of us were really able to concentrate and pretty much attend just about every session. So there was physically one of us there reviewing the material, hearing the material, being able to ask the presenters questions directly to, sort of get more information from them. And so I think we really had a very nice opportunity this year to really cover and look at the whole meeting. And already my colleagues and I are trying to put together a list, and we're already sort of figuring out, like you say, how are we going to do all this in an hour and 15 minutes, or, under an hour, so that we have time for questions. One of the unique aspects of this program is, unlike the big meeting, you really have one faculty member, for each section, and you really can I don't want to say accost them, but you can really get to know them, and you really have a unique opportunity to speak to them directly. And if you're not a person that likes to go to the microphone, the faculty linger, they're there during the breaks, during lunch, during breakfast, and you have an opportunity to introduce yourself, to meet with them, to network with them informally, but also to, pick their brain. And maybe it's material that's not been presented, or maybe it's a personal experience with a patient that you want to discuss. Frequently that we don't do a lot of eating because we're doing a lot of talking. And I think
it's a more engaging. It's a more engaging and probably more participatory kind of learning opportunity than, for example, hearing the same information during Renal Week.
Absolutely, and also I think it's based on the fact that it's got a smaller size and a smaller feel. It makes it more accessible to the audience, whether you're a more experienced nephrologist or maybe someone that's less experienced and intimidated in talking in front of groups.
So that would be even a better venue, perhaps, for younger people who don't have that confidence to walk up to the microphone and ask a question. Younger folk, fellows, and people who are early in their careers may find this a more attractive venue.
It certainly can be, and the other attraction to it is that it's compressed. So rather than asking your division chief or supervisor for taking off 3 or 4 days, and we do these in specific regions, and we do it in a very prompt schedule, and we stick to schedule. Dr. Yee is very good about keeping us on time, and we pretty much start at 8 o'clock on Saturday, and we end Sundays at 12, and so it's an opportunity you can fly in and fly out, or drive and fly out, or drive, and you can get it all done very quickly in about a day and a half.
On the schedules, I see that there are things called the X-Files. You make the diagnosis. What are those like?
So one of the unique aspects that Dr. Yee introduced, and I think it was last year, is that he asked the local facilitators to come up with interesting cases. And we found that participants really like hearing about cases. They like hearing about things that actually happened, and they like developing their own way of how they would evaluate those cases. And it's a much more open-ended and kind of lively discussion, and sometimes the cases really are quite bizarre and unusual and something you wouldn't commonly see. And sometimes they're just common problems that we see, like unrelenting hypertension and how to manage someone where you've got them on 6 agents and where do you begin the workup. And it's kind of a nice opportunity to have an expert in the audience or experts that can talk about specific evaluation strategies, management strategies, and also to hear participants how they would do it and what works in the community or what works in an academic center, what doesn't work in practical nature.
Who are the faculty? Who were the other transplant faculty, for example?
So this year, my other transplant faculty are Barbara Murphy. Dr. Murphy is a professor of medicine at Mount Sinai School of Medicine, and she's also the division chief of nephrology there as well. And her interests in transplantation include the genomics of allograft dysfunction or kidney failure over long periods of time. And she also has primary interests in the immunology of rejection and T-cell regulation. But she's also a division chief and knows a lot about general nephrology and rounds on the transplant service and has interest in clinical transplantation. Our other faculty member is John Gill. Dr. Gill is an associate professor of medicine at St. Paul's Hospital in Vancouver, Canada. I think this may be the first year we have a Canadian transplant representative. John's a really outstanding clinical investigator with experience and training in epidemiology. His interests are in transplant outcomes, clinical transplant trials, and also in immunosuppressive strategies. And so we have a kind of a nice balance of people that, do a lot of clinical research, some that do basic research, and myself where we're more translational.
So it's really the A-team. It's a group of faculty who are diverse, exciting to listen to, and have tremendous experience on their own.
I think that, one of the things that Dr. Yee, reviewed with me was to make sure that we had people that were dynamic speakers. So we just didn't want to have a bunch of talking heads that were well respected in the field of transplantation, but people we knew that had been proven teachers and had proven experience in getting information across, and also people that had insight, that they could take a large amount of data, clinical, basic, or translational, and sort of distill it down to a few key slides or a few key messages and be able to explain what was unique or useful in the long term about these kinds of presentations. And so, finding those people, we're actually lucky we have quite a number of members that are quite good in transplantation, but this year I think it's a great team and we work very well together.
It's true. The same is true for all the other areas. The faculty for acute kidney injury, for hypertension, end-stage renal disease, parenchymal disorders, and general clinical nephrology are all outstanding faculty who bring the same energy that you do, and the ASN is lucky to be able to have this caliber of individual participate in Renal Weekend. Dr. Mannon, thank you so much for spending time with us today. This has been Ron Falk for the American Society of Nephrology. Thanks for listening.